How are we doing at getting that balance between looking after the whole population and looking after the individual patients currently, do you think?
Yeah, I guess, as we've mentioned, I mean, being in Canada, we have universal access. The vast majority of the funding for that does come from ministries of health. And as the Deputy Minister of Health, I often find myself sitting in front of Cabinet making recommendations on where that funding goes. In any given year, every province in the country, every government has a fixed amount of money typically that they're dealing with, and so they will turn, when it comes to healthcare, they will turn to their healthcare ministry and say, okay, what can you do with X amount of money? And you try to bring a value framework to that, and governments want the same thing. And the example I'll give is a very simplistic example, but I think it underscores the challenge of trying to bring values to very difficult decisions. On the one side of the value chain, you can have, I guess, what's called the public health, and I mean small p, small h, the public health status approach to funding. So, for example, in a province the size of New Brunswick, 750,000 people, if we are down to our last $1 million that we can allocate somehow, and we're the province that has, I think, has the fewest publicly funded vaccination programs in the country. Putting $1 million into the vaccination program may benefit literally thousands of New Brunswickers. On the flip side of that, we are also in a healthcare system when someone is being treated through the hospital system or the acute care system, where, as has been mentioned, you know, the focus is the care provider with the patient and doing everything you can for that patient. And that's also a very valid perspective. But we now have situations with treatments, whether they be pharmaceutical treatments or otherwise, that can easily cost $1 million for that one individual. And so if you're in the situation of down to your last $1 million, and on the one hand you can make a decision that maybe impacts the health status of several thousand people, or that $1 million can be directed towards one individual where maybe you save their life, that becomes a very real value discussion, and I haven't found the framework yet that helps us with that. But I can tell you from personal experience, I have sat in the minister's office with a minister of health of the day having those discussions, and it is a very lonely place to be. And I think as a society, we're going to have to start to have those talks. So when I hear value, that's the struggle that I face.